we look forward and towards improving our health care system, and that will happen in the very near future. This issue is the #1 economic issue in our country, and I think you're finding out it'll be the #1 political issue in this country. And I say that except for the 25,000 people in my state that are flooded out of their homes. That's an immediate problem that they're probably not thinking about these things right now. 14 years ago was a time when we first made a serious, comprehensive effort at health reform. I hope that we can honestly say that we learned from the lessons of '94. We are ready now to take another serious look at improving our health care system. We know how complex the problems are. We know that fixing our health care system involves defining what it is that we're trying to fix. We know cost is a problem. We know that costs are rising faster than most people can afford. We know from the Kaiser Family Foundation that the United States spends more on health care as both a percentage of GDP and on per capita basis than any other OECD country. We also know that we can't fix our problem or our health care system by simply finding ways to control cost. We know access is a problem. We know that 47 million Americans went without health care coverage for all or some part of last year. People who are uninsured often don't get appropriate care. That's because they don't seek it. And when they finally do seek care, it is too often in the emergency room, the most expensive venue. We also know that we can't fix our health care system by simply finding ways to cover the uninsured, because quality is also a factor to deal with. For example, we know from Elizabeth McGlynn of the Rand Corporation's recent testimony before a committee that on average Americans get recommended care only 55% of the time. We know from her testimony that only 45% of the people suffering heart attacks get beta blockers and only 61% get aspirin. We also know that we can't fix our health care system by simply finding ways to improve the quality of health care provided. So there are problems, and there are multiple problems. Now we must move towards finding and implementing solutions. We must find solutions that are comprehensive. We must find solutions that recognize where we are today as well as where we hope we can be. We must recognize that we do not have a clean sheet as we start this conversation. Today we will explore many of the critical questions we will have to address as we move forward with health care reform. Ben Bernanke will soon be here. I'm extremely pleased that the chairman of the Fed would accept the opportunity. In a critical role he plays overseeing our economy, he is in an ideal position to bring gravity to the consequences of action or inaction in health care. After that, we will have several concurrent sessions that will allow us to focus on more specific issues. During our morning sessions, we'll explore the ways other countries provide coverage. We should listen carefully to other ideas while never forgetting that as history has uniquely taught us, we as Americans are different. We need a uniquely American solution. One of our morning sessions will follow the trends in employer-sponsored health coverage. Employers play a critical role in the organization of health care coverage. For the 158 million Americans who get health care through their employer, we must follow the Hippocratic Oath. First, do no harm. One of our morning sessions will focus on our delivery system and how it can be improved. As we move forward, we must seriously consider ways to move us from a system that pays for quantity of care that is received when you're ill to a system that pays for quality care that will keep you well. Our final session in the morning will examine opportunities of insurance market reform. While our market works for 158 million Americans, we must look to opportunities to improve the market so that we can provide affordable coverage to those who don't have it. During the lunch hour, we have the honor and privilege of hearing from Craig Venter. While we have our eyes on solving the problems we see in our healthcare system, we benefit from having our imaginations inspired by what healthcare may become. During this afternoon, we have 4 more very thoughtful sessions. One of our sessions will tackle the growth curve in healthcare. We simply cannot do enough to help our fellow citizens understand the consequences of inaction in addressing the growth of health costs. Another of our afternoon sessions focuses on the role of public programs in healthcare. Medicare, Medicaid, S-CHIP, the VA, and TRICARE all serve vital roles. They can also play a critical role in reform of the entire system. We will have an afternoon session on state-based reform efforts. Massachusetts has taken giant steps. We know many other states are considering reform. The federal government can encourage those reforms, and we can stifle reform with our actions, but also with our inactions as well. And finally, we will have a session this afternoon on best practices in healthcare. So as we move forward, we clearly need to find ways to ensure that Americans get the right care for the correct diagnosis when it is needed. Later this afternoon, we'll get back together and talk about what we've learned today and where we can go next. I'm looking forward to that and to the efforts of the Finance Committee that we will make in the future towards health care reform. In closing, I want to issue a challenge to all of you in the room today, and probably to people you know who aren't here and would like to be here. We do not lack knowledge. We have tremendous skill at expressing that knowledge, and you'll all hear that today. Unfortunately, we often lack the willingness to listen. We too often lack the courage to compromise. Too often in Congress, we see good ideas go by the wayside because of our unwillingness to thoughtfully consider many points of view. It is so easy to kill legislation in Congress. It is extremely difficult, as you know, to pass legislation. We see campaigns launched by advocates of this or that who claim to be speaking in the interest of many, but are more likely protectionists of limited specific interests. If we are to be successful in making real changes that benefit millions of Americans, we're going to have to simply listen and listen to each other. We're going to have to consider many ideas. We're going to use all the tools at our disposal to keep naysayers and protectionists quiet and hopefully on the sidelines. And we're going to have to show real courage reaching compromise. We can't all get what we want our way, using our idea. You know, I've been married for a very, very long time. I have long since given up thinking I can get what I want, when I want it, and how I want it. And it's called compromise in any venue. We all have to be willing to listen to each other, recognize strengths, improve upon weaknesses, and find a common ground that best serves our nation. The opportunity is coming. I challenge you to listen as you will challenge me to listen. I challenge you to compromise as you will challenge me to compromise. And I challenge you to make a difference and improve our health care system as you expect Senator Baucus and me to make a difference and to improve our health care system. Again, thank you all for being here.